One book that every psychology major should be acquainted with is what's called the DSM, or the Diagnostic and Statistical Manual of Mental Disorders. We are currently using the book, the DSM-4TR, which means the Diagnostic and Statistical Manual of Mental Disorders. Since 1952, there have been several editions of this particular manual. The first one, DSM-1, and the one we're currently using called the DSM-4TR, or the DSM-4 Textual Revision is what the TR stands for. This is a very important book. It's a book that deals with standardizing all of the nomenclature that psychologists use, so that when you've got a psychologist in Chicago and a psychologist in San Diego and they're reading the term about a mental disorder, they'll know what it is, and they'll both have the same definition. The DSM actually started in about 1952 when the APA decided that they wanted to start standardizing this nomenclature so everybody would understand. The DSM-1 then was 130 pages long, listing 203 mental disorders. It was an important tool for psychologists, psychiatrists, and any clinician to be able to use to make sure that they were all speaking exactly the same language. So after the DSM-1 was published, which shortly after World War II, then came the DSM-2 in 1968. And it was 134 pages long. It had listed 182 mental disorders. This was the famous edition where there were a lot of protests by a gay lobby group, and so the homosexual terminology was taken out of this book, and no longer was homosexuality considered to be a disorder. Then in 1980 came the DSM-3 and the DSM-3R. Again, each book gets a little bit longer. This one was 494 pages long and listed 265 diagnostic categories. Again, the whole purpose was to try to make this terminology that's used in psychological diagnosis standard from one part of the country to the other part of the country. It was a very important tool for psychologists to be able to use a manual such as this. Again, please notice how each edition gets longer and longer. The DSM-4 and the DSM-4TR, which we're using now, originally published in 1994, 886 pages long, listing 297 disorders. The DSM-5, which is to be the next edition, is scheduled for publication in 2013. It's interesting to note that the American Psychiatric Association no longer uses the term or the number in terms of a Roman numeral, but with the DSM-5 has changed that to the English number 5. One of the most outstanding characteristics of the DSM is the multi-axial system. In the DSM-4, there are 5 axes. Just consider these axes like a chapter or a subcategory describing different ways of looking at these disorders. Each axis contains a different context for these disorders, mental disorders, to be viewed from. 5 different axes. Axis 1 describes the clinical symptoms that cause significant impairment. Disorders are grouped into different categories, including adjustment disorders, anxiety disorders, and pervasive developmental disorders. Axis 2 in the DSM-4TR describes personality disorders and mental retardation. it's an important segment of the book that focuses primarily on long-term problems that tend to affect negatively other areas of the patient's life, such as self-care and interpersonal skills. Personality and mental retardation was axis 2, and axis 3, medical conditions. This is where the interface occurs between psychology and medical issues. These issues include medical conditions that may influence or worsen disorders that are found in axis 1 and 2. Such things as HIV/AIDS or traumatic brain injuries. Axis 4 describes psychosocial and environmental problems. Any social or environmental problem that may impact axis 1 or 2, these disorders are accounted for in the axis 4 assessment. Relocation, divorce, death, any kind of loss. Axis 5 is the global assessment of functioning, or called the GAF scale. This axis allows clinicians to rate the client's overall level of functioning. Based on this assessment, clinicians can better understand how the other 4 axes are being affected by the patient's lifestyle. Well, the DSM-4TR is simply an effort to standardize nomenclature of psychiatry and to bring mental disorders out of the shadows, and to make sure that all of these disorders are confined to one standard definition. The DSM, the Diagnostic and Statistical Manual of Mental Disorders, provides that standard. It's kind of like a dictionary of psychological diagnoses. If you're a student in psychology, and particularly if you are a psych major, you may want to make this book an addition to your library, the DSM-4 TR.